everyone, Brian Pla here with JuveXO. I'm very proud to have Dr. Alan Bauman here with us today. Thank you for joining us, Dr. Bauman.
Great to be with you, Brian.
Awesome. I'm very excited, not only because Dr. Bauman has recently been named one of the top hair doctors in the world, but because I was fortunate enough to have Dr. Bauman do my hair transplant, and he incorporated some exosome treatment during the procedure, and I'm extremely happy. I mean, actually, I couldn't be happier, and it's only been 4 months, so thank you so much. It's really been a game changer.
Oh yeah, well you're welcome, man. It's looking great. Holy cow! When I saw you from across the conference here, I was like, oh yeah,
it's working.
Cranking. It's cranking up.
So that's why I told you, I go, hey, listen, I really want you to come by the booth because I don't want to get too excited, but I want to show you something. I think that there's something there that you need to see, because I think we've had an accelerated hair growth process. I mean, between what's happened here on the temporal lobes and just the amount of, and you know, I'll share the before pictures later, but just really impressive as to what we've been able to do. So what are you seeing in your practice with exosomes?
So as you know, I've been doing regenerative medicine in combination with hair restoration procedures and treatments for many, many years. And so we've used a variety of different products along with hair transplants and PRPs and even the latest and greatest TED treatments, which is sonophoresis. But specifically when we do hair transplant surgery, now we can use JuveXO to do a number of different things to help accelerate not just the recovery from the procedure itself, but also accelerate the regrowth of those transplanted hairs.
Excellent.
So, as you know, with your procedure, we did a few different things. We did apply it to the scalp.
Yep.
We did soak the grafts.
You took a little bath?
In the JuveXO bath.
Yeah.
So, I think all of those chemical messages, biologic messages that we're providing to the hair follicle can certainly enhance hair growth and absolutely accelerate healing. And look at your results. Really, at 4 months, and we were just talking about this a few minutes ago, sometimes patients at 4 months are like, I don't know, is it working? Is it not? I don't think you had any doubt.
No, not at all.
You know, that things were cranking up. And usually at 6 months, we'll see half of the result and the full result in a year. I think you're about 6 or 8 weeks ahead.
That's it. So again, I know it's early on and we have to quantify it with the data, but you would attribute that acceleration potentially to the regenerative aspects of the cell therapy.
Absolutely. So what we know is the cell signals, right, that we're providing with exosome therapy tell the body to rejuvenate, to repair, and to recover. And so when we apply that at the right time and the right place, so to speak, that's where we're getting the activity, right at the level of the scalp in terms of recovery, reduced inflammation, faster return to normal skin tone and texture, and then, you know, on the back end here we have accelerated hair regrowth.
Awesome.
You know, but yeah, we're gonna quantify this. We're gonna be looking at this further. We're gonna be doing some density analysis. We're gonna be doing hair check measurements. We're gonna be looking at it more carefully and closely. Obviously, you know, one case study isn't the end all be all, but at least it gives us some insight as to what to look for and how to treat the patients moving forward.
And I think Dr. Bauman, you know, at his office, he has a really extensive amount of diagnostic and quantitative information that he could pull, because a lot of times it's so anecdotal, so subjective, and he really, from the second you get to his center, first of all, the experience is great, and I can tell you, I went through 2 12-hour days. I mean, it was really exhausting, but at the end, it's you know, the juice was worth the squeeze, right? And so to go through the process and see the diagnostics and now I'll be able to quantify. So I'm at the 4-month mark. Soon I'm going to go in. In fact, I'm going to go in at the 5-month mark to measure, because as he said, I really feel that we're accelerating. So I want to see that trajectory, that projection of growth.
Yeah. So it's not uncommon when we're doing these kinds of tests and even just regular management of patients, whether it be just for male pattern hair loss, female pattern hair loss, and hair thinning. We'll do AI-powered microscope evaluations that'll look at the hair density and the hair caliber in each of the different zones. We can compare that over time. Obviously, the clinical photography tells us the story from across the room. What does it look like? But hair check measurements in terms of hair bundle, cross-sectional trichometry, those types of things are what we're going to use the data to quantify not only how much is growing, but when does it start, and how robust is it going to be? Right,
because you want to also be able to mitigate any other potential sources that are contributing to hair loss. Right, because you can do the best job with a transplant, but if you're having, you know, scalp issues or other, you know, genetic stuff that it affects the outcome.
Yeah. So the algorithm, I mean, we kind of jump to the end, which is the hair transplant. If the follicles are dead and gone, that's what you're going to need to replace the hair follicle density. But remember that male pattern baldness is something that occurs over time. It miniaturizes and weakens the hair that's at risk from the hairline all the way through to the crown area. So at Bauman Medical, we take a very holistic approach. We're going to look at lifestyle factors that could dysregulate the hair follicle function, everything from sleep-wake cycle dysregulation to what's your nutritional and fuel intake, inflammation in the body, what are the stress impacts on your hair and hair loss, medications and medical conditions, obviously, before we even start with non-invasive therapies to help protect, enhance, and preserve the hair follicles that you have.
Awesome. Well, I really appreciate the fact that, I know from someone who I'm sure everyone's trying to offer different products to incorporate into your practice that, you gave JuveXO a shot. I was the guinea pig, right? So I was willing to give it a shot. So there was a lot of pressure on me but I really trust in our product. And so hopefully we'll be able to continue to work together on
Absolutely,
on that front.
absolutely. And
Awesome.
happy growing. You've got a lot more growth coming in.
Awesome.
So
Thank you so much, Dr. Bauman.
You got it,
Appreciate
Brian.
Thank you.